Coronary heart disease is the leading cause of death for men and women in the United States. It covers a range of conditions that affect the blood vessels going to and from the heart, from discomfort to life-threatening conditions like heart attack. Dr. Alexander Kulik of Boca Raton Regional Hospital is here to tell us more. Thank you for joining us.
Thank you very much for having me.
So what is coronary artery disease?
Well, coronary artery disease is narrowing or blockage of the arteries of the heart, limiting the blood supply getting to the muscle of the heart.
And how is that caused?
Well, we believe it's a combination of aging and the accumulation of cholesterol from our diet in the blood vessels of the heart that leads to these narrowing, what we call atherosclerosis, and ultimately blockage of these arteries.
Now, are there risk factors, and what are some of those?
Well, smoking is one of the leading contributors to the development of coronary artery disease. So that's a risk factor that can easily be eliminated from a lifestyle point of view. Getting older, as we age, the coronary artery disease can accumulate, and other common risk factors include high blood pressure and diabetes.
This would be, I guess, what you'd call an equal opportunity disease affecting both men and women. So when do men become more at risk, and when do women become at risk?
Well, that is true that men appear to be at risk for coronary disease at an earlier age. Typically, they develop coronary disease at approximately 10 to 15 years earlier compared to women. It's not clear what that's related to, possibly estrogen in the women's circulation. So typically men get coronary disease at age 50 to 60, whereas women typically develop symptoms related to coronary disease at age 70 to 80.
And speaking of those symptoms, what are some of those or signs that you should go see your doctor?
Well, if a blockage develops in an artery, then that can limit blood supply to the muscle of the heart and actually lead to death of the muscle, which is what we call a heart attack, a myocardial infarction that can lead to significant chest pain. Often it radiates to the jaw or the arm. That can be a life-threatening condition. But if a narrowing progresses over time, that can cause what we call angina, heaviness or tightness with activity. Those are symptoms that should definitely lead someone to see a doctor soon.
Now, we always hear that prevention is the best medicine. What are some things that you think people can do today to affect their livelihood tomorrow?
Well, quitting smoking is obviously very important. Limiting cholesterol in the diet and also checking one's cholesterol level, potentially using a statin medication to lower cholesterol levels and control blood pressure with medications if necessary. Of course, eating a healthy diet and exercise are also proven good preventative methods for limiting coronary disease.
All right, thank you very much for joining us, Dr. Kulik. We appreciate you being here. And Boca Raton Regional Hospital sponsors our experts and underwrites our Ask the Doctor feature.